Part of living with COVID means living with new variants and subvariants. Our world-class health surveillance operations are currently keeping a close watch on a subvariant of Omicron called BA2, which the UK Health Security Agency has marked as a variant under investigation, one below a variant of concern. 1,072 genomically confirmed cases of BA2 have been identified in England, while early data from Denmark suggests that BA2 may be more transmissible. There is currently no evidence that it is any more severe. In addition, an initial analysis of vaccine effectiveness against BA2 reveals a similar level of protection to symptomatic infection compared to BA1, the original variant of Omicron. In December, I argued, and this House overwhelmingly agreed, that the weight of clinical evidence in favour of vaccination as a condition of deployment outweighed the risks to the workforce. It was the right policy at the time, supported by the clinical evidence, and the government makes no apology for it. It has also proven to be the right policy in retrospect, given the severity of Delta. Since we launched the consultation on vaccination as a condition of deployment in the NHS and wider social care settings in September, there has been a net increase of 127,000 people working across the NHS who have done the right thing and got jabbed, becoming part of the 19 out of 20 NHS workers who have done their professional duty. During the same time, we have also seen a net increase of 32,000 people getting jabbed in social care, including 22,000 people in care homes and 10,000 people working in domiciliary care. Given that Delta has been replaced, it's only right that our policy on vaccination as a condition of deployment is reviewed. So I ask for fresh advice, including from the UK Health Security Agency and England's Chief Medical Officer. Omicron's increased infectiousness means that at the peak of the recent winter spike, 1 in 15 people had a COVID-19 infection, according to the ONS. Around 24% of England's population has had at least one positive COVID-19 test. And as of today in England, 84% of people over 12 have had a primary course of COVID-19 vaccines, and 64% have been boosted, including over 90% of over 50s. The second factor is that the dominant variant, Omicron, is intrinsically less severe. When taken together with the first factor, that we now have greater population protection, the evidence shows that the risk of presentation to emergency care or hospital admission with Omicron is approximately half of that for Delta. Given these dramatic changes, it is not only right but responsible to revisit the balance of risks and opportunities that guided our original decision last year. While vaccination remains our very best line of defence against COVID-19, I believe that it is no longer proportionate to require vaccination as a condition of deployment through statute. So, Madam Deputy Speaker, today I am announcing that we will launch a consultation on ending vaccination as a condition of deployment in health and all social care settings. Subject to the responses and the will of this House, the Government will revoke the regulations. First, I have written to professional regulators operating across health to ask them to urgently review current guidance to registrants on vaccinations, including COVID-19, to emphasise their professional responsibilities in this area. Second, I have asked the NHS to review its policies on the hiring of new staff and the deployment of existing staff, taking into account their vaccination status. And third, I've asked my officials to consult on updating my department's code of practice, which applies to all CQC registered providers of all healthcare and social care settings in England. They will consult on strengthening requirements in relation to COVID-19, including reflecting the latest advice on infection protection control.